My name is Dena Moskowitz. I'm an assistant professor of clinical urology here at UC Irvine, and I specialize in female pelvic medicine and reconstructive surgery. Pelvic organ prolapse is another really common condition in women, and something that women don't like to talk about typically, but it can cause really significant impairments in quality of life, and it's definitely something that's treatable that we can address. So what it is basically that the pelvic organs and pelvic muscles have become weakened, and it's usually due to vaginal childbirth. And there's three structures mainly that we think about causing prolapse. So it can be prolapse of the bladder, which is referred to as a cystocele, prolapse of the rectum, which is referred to as a rectocele, or prolapse of the uterus. And there's, again, lots of different treatments for this. So some women, if they don't have any symptoms and if they just find that they have prolapse on exam, no treatment is actually needed unless the symptoms are bothersome. Some of the main symptoms are sensation of a bulge from the vagina, difficulty emptying the bladder, or difficulty having a bowel movement. So for treatment of this, you can do, again, pelvic floor physical therapy, which can be really helpful. And there's also something called a pessary that's worn on the inside of the vagina that can hold the bladder or uterus up to prevent it from prolapsing down. And for people who want something more definitive, we can do surgery. And there's two major approaches to surgery. So one of those is through the vagina. And when we go through the vagina, we typically do the repair with just some sutures using your own natural tissue. And the other way is through the abdomen with a robotic surgery, which typically involves placement of a piece of mesh to hold the vagina up. And each approach is dependent on different factors as far as patient preference and the anatomy involved, and if they've had any procedures before and how healthy they are overall.